I'm a physical therapist. I treat patients with all kinds of musculoskeletal conditions, or even mild peripheral nerve issues or central nerve things like disc issues or radiating pain, all locally here in Greenville. But I also have a passion for chronic low back pain because I believe it is often mis not mistreated. I think we just maybe as a profession, if you've got chronic persistent low back pain and it's been months, years, even maybe even decades, then chances are you need to be calming the nervous system down. And what ends up happening is when you go to physical therapy, you end up getting treatment for your back, and it's often not enough to move the needle. So there are certain variables that people in the clinic cannot address, like sleep, stress management, or nutrition, talking about social connectedness. There are variables at play that we just don't have time to talk about. So I am going live again. This is not a podcast about gardening. This is not just another white dude doing a podcast. I'm here to answer a question on Reddit, actually go through and figure out which questions I can answer with the time that I have. There are some questions on Reddit that I don't feel are necessarily in my scope. A lot of the MRI imaging, for example, that's not what I'm going to do. I will see some impressions that I am skilled enough to interpret, which I'll take a stab at and just give my opinion about, which might be helpful because I will post these to those questions for these people. So let me go ahead and share Reddit for you. Tried this last night, had some technical difficulties, figured it out. Of course, there it is. Okay. So if you have questions, you can comment if you're following along. If you're looking at the replay, comment some more. I'm going to make sure I can actually see what's going on. All right. If you have lower back pain and it has been persistent for a long time, you've kind of lost hope, you're frustrated, then ask maybe some of the bigger questions that you might have that you haven't had answered before, right? So oftentimes I get people who are stressed to the max, and their GP or their physician or their primary care doctor has not even asked them how they manage their stress, how they manage their sleep. So if this resonates with you, uh, please reach out and ask if you've got questions. Okay, so here we have Reddit. There's usually, so I go through the last 24 hours and I'll try to answer as many questions as I can. I know in today's day and age, we have a finite amount of attention span. So some of these I might skip, but you know, uh, this one right here, having terrible back pain. I'm just an average 18-year-old female weighing 140 pounds. Lately, I have terrible, sharp, stabbing back pain that begins at the top of my crack and runs down my left leg. It sometimes throbs and hurts to even move. And so, just right off the bat, thinking about my scope of practice, what we look for in cases like this is, was there a mechanism of injury? And if you don't have a mechanism of injury that you can put your finger on, and you can't get comfortable in any position for the day, even if you sit down, lay down, stand up, walk, and you're rolling to your side, it still hurts. It hurts throughout the night. It's unrelenting. It's probably time to call your doctor just to get in and get looked at. The other things that are scary that we look for that are red flags are general spontaneous lower extremity weakness or bowel and bladder issues, right? So we are um, trained to look for red flags. If you can get comfortable, if you do not have spontaneous leg weakness, if you don't have, bowel or bladder issues, this is well within the musculoskeletal kind of realm and can be treated. Typically, back pain gets better within 3 months on its own. And if it doesn't, it becomes chronic. There's other things to look at, whether it's movement, exercise, breathing, those sorts of things. So the question is, does anybody know what this is or this could be? Not really without having a actual assessment. So consider those things. If you don't have any red flags, it's best to get checked out by a medical provider and keep moving. So next question, um, let's help. Uh, can someone help me understand these results? Okay, so this is something that we have been trained to do. Looking at these findings, it looks like um, if you just go down straight to the opinion, right? So they've underlined several things here. Looking at the height of the vertebral bodies. So if you've got disc symptoms, they're going to look at the height. They're also going to look at if you've got, let's see, cord atrophy. So if you've had a bulge for a significant amount of time that's actually compressing part of the spinal cord, you will have decreased input to that area. And once, just like our muscles, if we don't use them, they will atrophy. Just like nerves, if they don't have a consistent impulse, they're being used, they don't have a stimulus, they're not going to adapt, they will actually maladapt or reverse the other way. So, good news is they're not seeing any cord atrophy, no signs of cord compression or epidural fluid collections. And what they did find is mild facet degenerative changes. That is very normal as we age. So I call it wrinkles on the skin. I didn't come up with that, but I stole it, and it makes perfect sense. So if you look at 100 individuals, you're gonna find degenerative changes almost on all of the scans, MRIs especially, and even here they found a disc bulge. So it said a slight indent, but no signs of cord atrophy. So it must not be serious enough that they are warranting any other intervention, but definitely follow up with your radiologist and stay connected with a medical provider if you feel like getting further information about this or what to do is important. The thing is that a lot of Reddit people don't take into consideration is what our profession is meant for, is like if you're having back pain, what can you do? What can't you do? When do your symptoms come on? How irritable are you? And when we consider all those factors and prescribe exercises, the goal is to get people moving and not avoid movement or be fearful. So that is part of our expertise, right? You gotta get moving, like, life doesn't stop. 50 years ago, 60 years ago, the treatment for acute low back pain was bed rest, and in the hospitals now, it's move people as fast and as soon as possible. I say fast, I mean timeline. We don't want people laying around in bed. Takes a couple days to start to atrophy. My wife's a veterinarian, asked her to find the herniated disc in my right. My brother's a veterinarian radiologist, and I'd say, ask a radiologist. Will this heal on its own? What's awesome about the human body, I'm not even gonna really spend a lot of time looking at this because it's like, I think MRIs are awesome. They can be really helpful in serious situations. What's interesting about indications for MRIs or further imaging are changing for back pain. So, they'd have to have one of those red flags I mentioned earlier for them to rush off. Like, that should be the industry standard. I think a lot of physicians are pushing for that, and it's been, a campaign. The name of it is escaping my mind. I will put it in the comments if I remember it later, but the indications for running off to get X-rays and MRIs when there hasn't been trauma, when there isn't bowel bladder changes, when there are spontaneous lower extremity weakness has, changed. They don't wanna spend the money on imaging because they're finding all these images for people who have, um, without trauma, chronic radicular symptoms or even acute radicular symptoms, and they're finding that you could scan people who are asymptomatic, and you're gonna find similar findings. So, this question here caught my attention really quickly because losing a best friend to suicide and then a brother 2 years later, that is extremely burdensome on our experience as kind of a human, right? The pain starts around when she lost her best friend, and it's never ending. There hasn't been a day where she's been pain-free in years, and, this is this is why I'm called to help people with chronic lower back pain that's very persistent is because there are people out there, right? This 80% of the adult population in the world will have chronic or acute low back pain at some point in their adult life, and that is a lot of people, and many people hit rock bottom, and there are many variables that contribute to lower back pain, like I mentioned at the very beginning of this live call, that are overlooked. It's not like the cause of your back pain, but they do contribute to sensitivity. So when we run people through the modern, medicine gamut, it's imaging, it's opiates, injections, it's overdiagnosis, and it's not very good at looking at the person and seeing what they're dealing with, and really asking, "Hey, what lifestyle factors can we shake loose and have them process grief like this?" So, seeing an orthosurgeon did absolutely nothing for me, said there's no swelling, didn't even look at her back, just told her that was she was overweight and that's the problem, although research doesn't necessarily support, uh, the weight on the skeletal structure as being the issue, but probably more so the sedentary lifestyle. Movement is what keeps our joints, our ligaments, our muscles healthy. So, you know, here I haven't even finished this, but, she's talking about obviously a lot of stress. So, my biggest takeaway and advice is to, of course, begin to know that it's okay that you're having pain, and a physical therapist should be able to help you find entry points to movement. But it's difficult, right? If everything hurts, right? As soon as you sit up out of bed and put your feet on the floor, life is already too much, system's already overloaded, you're gonna have pain, and so, when you take a step back, you look at stress management, you look at sleep, you look at meaningful exercise, you look at social connectedness. If there's anything missing in those and even fulfillment, like life's purpose, if any of those pillars are missing elements that are missing in your life, it's time to address something in those buckets or those pillars because chances are you can find something that you can take a stab at and work on. And once you accept and process these certain things, again, this is a lot. I'm not a licensed therapist. However, we do know that these things contribute to chronic back pain. So, my advice is definitely consider big picture, not just the structure, and um, keep moving even if it's a little bit every day. Okay. Well, let's close that question. Coming up on 15 minutes, which is a very, long video, and I'm not sure everyone has that attention span. So, let's see if there's one other quick one I can talk about. How likely is it that my mild back pain will get worse? I have lumbar back pain when I low back pain when I stand up, only then, but I'm scared it will get worse in the future and I won't be able to sit, lay, or walk pain-free. I know I have hyperlordosis and weak body muscles due to laying in bed for a long time after an accident. I try to exercise muscles, go swimming, even without a rehab at hospital, but it just seems not enough. So what's interesting is if somebody has been in an accident, stagnant, not moving, not exercising, and, um, we're not getting appropriate stimulus on a regular basis, those areas of our body that need that exercise. Yes, walking around might get easier, but to jump right into an exercise program or go swimming, it might be too much. So, you might need to get better at doing less things. I there's such a limited amount of information here that just looking at the question alone, how likely is that my mild back pain will get worse? Nobody has a crystal ball, and what is kind of relieving from my end that I try to reiterate to people is that if you can take an image of somebody's back and there is sign of damage or tissue issue, bulging disc, degenerative disc disease, and they are asymptomatic, what does that tell you about the people who are symptomatic and have those image results? If you have a whole party of people in the data, in the research, it shows up over and over again that isn't pointing to clinical symptoms and yet isn't pointing to clinical symptoms. What does that even mean? If what I mean is you have positive image findings, but somebody's asymptomatic, right? They might not have ever even gotten imaging in the first place if they weren't, part of some study. Or maybe you're going to look at something else and you have incidental findings, meaning, you have back pain, but the degeneration could have been there the entire time for a number of years. So, all this to say, rambling on, nobody has a crystal ball. It's really not likely that your back pain will get worse if you keep moving and find things that are meaningful to you in terms of exercise. Um, it's funny I say that, kind of stepping back and reflecting is I said there's no crystal ball, and then I said it's probably not gonna get worse if you do exercise and take a step back, and it's like, that is the same thing. So I basically just said, "I don't have a crystal ball," and then I proceeded to say, "I have a crystal ball if you do these things." So that's not helpful, but I would kinda just wrap up this question by saying, really, no one really knows for sure. What you can do is find meaningful exercise, take care of yourself, get moving in ways that feel good and comfortable. Don't worry about the short term in regards to what you can't do. Focus on the long term, get on a walking program, make it progressive, start with 10 minutes, um, try breathing exercises, those sorts of things. Just general advice, for back pain, I think will go a long way, and doing less will go a long way. That's how I would approach that. After 20 minutes of rambling, I'm kinda losing steam. So, again, thank you for tuning in or coming back and looking at this. If you've, found this helpful, you have chronic lower back pain, please reach out, ask questions. I'm here as a resource for all things, health related, all things low back and musculoskeletal or chronic pain in general. So, thanks again. Next time, we will have a podcast on, the benefits of fruit. Okay, I'm out.